everyone, and welcome to our Monday Minute. Today we're going to discuss the requirement of physicians to be recorded in the PECOS system. For years, home health agencies have had the responsibility of ensuring that any referring or certifying physician was listed in the PECOS system, which is the Provider Enrollment Chain Ownership System. This system is basically the Medicare enrollment system where all providers of Medicare services that bill Medicare are enrolled. Hospice will be required to have all certifying physicians and attending physicians enrolled in PECOS moving forward from May of 2024. It is imperative that hospices understand the significant impact of not complying with this situation. If the attending physician and or certifying physicians that are listed on your claim are not in the PECOS system when the claim is processed, your claims will be denied. And there will be no getting it back. You need to ensure that you begin the implementation of this PECOS confirmation immediately, even though it is not technically required for implementation until May of 2024, because you cannot wait till May 1st and flip a switch and then it happen. Also a part of the PECOS system, in order to be included in the listing in PECOS, if you are dealing with a physician who is not currently billing Medicare, they can opt out of billing Medicare, and by filling out that appropriate form, they will be listed in the PECOS system. This process is basically to validate that allowable practitioners are certifying your patients. And again, this has been done in home health for years, and there have been problems, meaning there have been times when the patient or the physician appeared to be listed in PECOS, and then when the claim was processed, they weren't. Things happen. Supposedly, the hospice final rule says that there will not be a problem if the physician becomes unenrolled in the PECOS system between the time that you originally confirmed they were in the system and the time that you bill. However, to the contrary, we have definitely had issues with this in home health, so we'll have to see how that plays out. But you must establish that they are enrolled in PECOS at the beginning of an admission of a patient and at recertification. They also emphasized that it needed to be checked at each recertification point. We are going to provide you links in this content of this minute to the PECOS portion of the CMS website. There will be a link that you will even be able to provide to providers or physicians that might not currently be enrolled that could go through that process. Many of the home health and hospice EMR systems are already automatically checking the PECOS system once you enter a physician into your system. If your EMR is not currently doing that, you will need to make sure that you are checking individually. Thank you for your time today. I hope this has been helpful. And if there is anything HPS can ever do for you, don't hesitate to reach out and let us know. I hope you have a fabulous week.